Great. So welcome everyone to today's Connector training series. This is Phelan O'Neill with Young Invincibles. Hope you are doing well. I want to start with just an overview of today's agenda. We like to start all these trainings and talk about big picture, what the connector is, what it does, why we use it, all that good stuff. We want to quickly, although now that we're sort of deep into open enrollment, I want to spend a little less time than usual talking about some of these new features and spend more time showing them to you all. And then we're going to take a live look at the connector, and we're going to see along the way all the different things you can do and sort of the workflow and logic behind it. So welcome to OE7. For those of you for whom this is your first open enrollment period, welcome. We're glad to have you here. For those of you who've been around for a couple years, welcome back. It's good to see you again. And for the couple of you who might have been here since the very beginning, since OE1, since OE2, it's good to have you along for the ride still in this wild and crazy journey that we call open enrollment. So, all that being said, what is the connector? What are we here to talk about today? Big picture. The connector is a scheduling and reporting tool, and it's designed to help keep things simple. What do we mean by that? We mean one place for you to put your availability for open enrollment and beyond, one place for consumers to go to book appointments and make sure that they can get the one-on-one assistance that we all know is so vital to the success of open enrollment and to people getting the help that they need. And it means one place for everyone to analyze the data and tell the success of open enrollment. We at Young Invincibles are big believers in data-driven outcomes and using data to tell the stories of our success and being able to tell potential funders, CMS, the media, other members of our coalition, internal stakeholders, etc. Why it is that this is so important and all the accomplishments that we have as part of our broad narrative of success. It also makes it easier for consumers to find you. We have what's called the public-facing side or the widget side of the connector. It's something that you can put embedded on your own website. It's something you can use our own version, and we make it easier for consumers to come and find you. I and a number of national partners through text, through email, through our own outreach are directing people to the connector. Your community partners can be directing people to the connector. It really makes it so that consumers can come to you and we can help bridge that gap for some of these harder to reach populations. It also makes it easier to work with other assisters in your area. You can all have one simple place to direct consumers to, one place where you're all booking appointments. You can work together collaboratively across coalition lines to book appointments for each other and make sure that everyone is getting their work done and spend less time fussing with Google Forms or shared calendars or whatever. So that is the connector. I want to talk about some things that are new this year before we dive in and take a look at the whole tool itself. So we broke it down into 5 big components. Improved reporting, exporting schedules to personal calendars, one-off appointments and more customization in your schedules, widget improvements, as well as a new homepage that went live last week, and some other minor tweaks along the way. So to start, let's talk about these first big 2, improved reporting and exporting schedules to personal calendars. We'll look at all these features towards the end of our presentation, but basically what you need to know is that we've expanded your ability to access connector data, right? The power of the connectors and the data that's in there, and we want you to have more access and more use for it. So we have added upcoming appointment reports. We have added reports of appointments that have not been yet closed out, as we call it here at Young Invincibles, or fully updated to reflect the outcomes of the appointment. And we've given the opportunity to sync whatever personal calendar you have. Your phone calendar, your Google Calendar, your Outlook calendar, if you use Apple Calendar, if you use, I don't know, those are all the calendar apps I can think of right now. But whatever major calendar app you're using, we want you to be able to see what upcoming connector appointments you have, in one place without having to juggle between the connector and your personal schedule and back and forth. We're also offered more flexibility and more customization in schedules this year. This was a big improvement from last year where we had to pare down some functionality to improve our speed and to make the tool sustainable going forward. We've also made some improvements to the widget, or our front end side of the connector, to allow for consumers to book at individual locations as opposed to having to go through the search process. We hope that this can be used in the form of sort of RS3P links for events, for outreach at specific places we will be doing enrollment, or for targeted geographic outreach. You know, maybe you have 4 enrollment centers in sort of 4 corners of the county that you work in, or of your region, or your city, or your neighborhood, or whatever, and these could be spread out that way, and you can direct people depending on where you are to book at an appropriate location. So, as we said, you can use this for promotional materials, enrollment events. You can direct consumers to a specific location. You can use this to put on flyers. You can use this for anything. And the format is pretty simple here. widget.getcoveredamerica.org/? Location equals, and then the location ID. We will look at what that is in a second. But again, real simple to do. And this gives you a nice way to promote specific locations to your consumers so that they can custom book appointments just for, you know, an enrollment event or a specific site and not have to navigate through a bunch of results. Lastly, we made some improvements to the homepage and some other minor tweaks. We fixed some issues with county and zip code tracking. We added a brand new homepage late last week with brand new support materials covering old and new features. We're uploading regular connector trainings to this, and we're going to start doing some more, you know, bigger breakdown support videos so that you all can understand a little more logic behind some of these things, some things that we don't have time to dive into in total depth between these trainings. And then I'll just say ideas are welcome. If you have feedback on the connector, if something seems wrong, we'll talk about at the end how to share that. But we're always open to hearing your ideas, even if we can't always implement them. We build this tool for you all, not for us. So your ideas should drive our decisions. So enough about that, enough of these slides. Let's take a live look at the connector and see what all the fuss is about. So we are going to start here with our front end or public facing or widget side of the connector. We here at Young Invincibles promote our version, which is at widget.getcoveredamerica.org. Your organization, your local coalition, you may have embedded this on a different website. You may use a different place to direct consumers to for your website. This is Cover Arizona. They're one of our partners. They use the connector and they have it embedded on their website here at coveraz.org/connector. Right, and it looks the same way and it works the same way. So again, you may go to a different website. You can embed this on your own organization's website. We can customize it a bit for you to match your colors. But it works basically the same way everywhere, which is that you enter a zip code. We'll use 85016. You select a search mile radius anywhere from 1 to 100 miles. We'll start with 10. And then you could narrow it down to any specific language you were looking for assistance in. The default is going to be any, because we assume that, you know, everyone is offering assistance in at least English, and that, you know, any in default. But, you know, maybe you're looking for just Spanish language appointments. Maybe you're looking with an Arabic or Creole or Cantonese or Cambodian immigrant community, and you want to find assistance that you know is available there in just those languages. You can narrow your search down that way if you know that there's going to be results. But again, that's up to you all to make available appointments in, you know, Arabic or Farsi or French or German or whatever. So we're going to leave it at any, and we're just going to search here. Now, we can see here results are going to be sorted first by availability, by distance, and second by availability. So, right, if we look here, we see these locations are some of the closest: Midtown Health Center, Keough Health Connection. They're available this week, available next week, and going out further. We have, or available in the next kind of 90 days. Further out, again, 3 miles versus 2 versus, I think, 0. I think that's in the heart of that zip code. Right, so we can have sort of ideas for consumers about the name of the place, where it's at, roughly how far it is, and when they're likely to be able to be seen. You can see all these different resources here going out as far different as the 10 miles that we set, right? And we're looking at all the locations that you all, I'm sure, are familiar with. WIC clinics, health centers, schools, nonprofit offices, etc. You also see below we have a listing of locations that don't have schedules up, and that you may need to call to schedule an appointment. They may or may not be offering assistance. They may not be offering assistance all the time, but they're there as sort of backup or important resources, even if you can't schedule an appointment. Let us pick one of these. Let's pick this one here, Keough Health Connection at St. Joseph Family Medical Center. It's available this week. We can see up here, we can see a map of where this location is, and we can zoom in. So I can see that this is right off of 7th Avenue and Thomas in Phoenix. And I can see zoomed out, it's sort of between Highway 51 and Highway 17, north of Highway 10. Maybe I know where Phoenix College is, and that's a useful landmark for me. But the map sort of gives people a good sense of where it is. And then we have the same address information that we saw before. Cool. So looking through here, we see it looks like they're offering a number of different services or appointments. We have their title for it. We have the time that the appointment's at, the name of the assister. In this case, it looks like they're just sort of having everyone cover everyone. And the day of the week and the day of the enrollment. Right, so it looks like their next availability is on Monday the 11th. I'm not a morning person. I can't get up that early. 8:30 sounds awful to me, but you want to know what sounds great? 1 o'clock p.m. I have a lunch break then, and so I can sneak over down the street, get my healthcare benefit application taken care of, and be back in time for the end of my lunch break, as opposed to having to go in before work. So I say I want to schedule this appointment here for 1 o'clock at St. Joseph's. So I click the schedule online button, and it gives us a simple form to fill out. Above, you can see the same information we've had. We have the location, we have the date and time of the appointment, as well as the assister, all that good stuff. So we'll put in here my name, invincibles.org. Right, so I filled out this form. Name, email, phone numbers, boom. You can opt out of receiving email updates from Young Invincibles. We like to send people reminders on key healthcare deadlines, when to get enrolled, health insurance literacy, things like getting your flu shot, getting an annual doctor's visit, some good stuff. So people should make sure to get those emails, but of course it's their right to opt out. And then I would schedule an appointment here, which I'm not going to do because I don't want these poor folks to think that I'm coming to book an appointment with them when I'm not. But if I did, there'd be a couple things that would happen. First is that the consumer would see a confirmation page. It would also have a link to a PDF of resources to bring to an appointment. Things like W-2, pay stubs, other income verification, social security numbers of everyone being enrolled, names of everyone being enrolled, lists of medications or doctors that you want to make sure are covered or covered well under your plan, so that people have an idea of what to bring to their appointment. The second thing that would happen is that both the consumer and the assister would get an email notification about the appointment, and the consumer would get a text message reminding them of the appointment. initially, right? So that way everyone's getting a heads up, hey, this appointment's been booked. Here's the time, here's the date, here's the number to call if you have any questions. The final thing that happens is that there's another round of notifications that comes the day before an appointment, right? So the assessor is reminded, hey, here's your upcoming appointments. The consumer gets a message saying, hey, reminder, you have your application for health insurance tomorrow, the 11th at 1 p.m. Giving them an extra reminder and making sure that on top of your own confirmation efforts, that there's an extra boost to get them in the door and make sure that they go through with this service. And we found that that's a really useful way that the connector has to sort of boost attendance rate and completion rate for appointments. So let's pause here. And I want to see if anyone has any questions about the widget or about anything else we've talked about so far. Cool. So you're probably saying to yourself, Phelan, you mentioned something about an RSVP link. How the heck does that work? Where do I find this information? That's a great question. We've got one open here, right? Widget.getcoveredamerica.org, question mark, location is 11635. And that looks like it's a Keio Health Connection office on North 4th Avenue. And it looks exactly the same, right? Can schedule an appointment. Got all the information here. Everything looks the same. Now, how do I know that this is this number, right? Where does this number come from? Well, if we go into the admin side of the connector or the back end, right, this is a page, if you've logged in before, that I'm sure you've seen a couple of times, right? This is the standard location page. We've got all of its information. We've got that same map here. You'll notice I've highlighted in the address bar this same number, 11635, after locations and before update. That's what we call the location ID. So I could change this location's name to Phelan's Health Center Extravaganza and change its address to 1111 North 1st Avenue. And all that stuff could be changed, but this location record would always be 11635, right? And so then you just plug it in here and you can just narrow people down as opposed to having to search to book an appointment at that specific location. Again, if you're doing outreach at a library, a community college, some other place where you're going to be coming back and doing enrollment, it's great. If you're in the area of a place you're offering enrollment, it's great. If you want to direct people to your office, it's great. Really a useful tool to sort of funnel people to the most convenient locations for everyone. So that's the widget, and that's some cool stuff that we've added this year to make it more useful and more powerful than it was before. So now let's take a look at the back end or admin side of the connector. You'll notice here, if you haven't logged in this week, or if you didn't notice, we have a homepage now. We have a nice FAQ that you can drop down to get answers to your questions. We have links to, amongst other things, our brand new user guide that we've put together that has a lot of different resources. And we have a link to our still developing YouTube playlist series that's going to be recorded training series. So for instance, this video will be going up there. Really going to be a great opportunity for people who, for instance, don't have a chance to attend these trainings live to get some extra help and to see some walkthroughs. So that's the homepage. We're going to do the rest of this training a little differently because I want to spend a lot more time talking about the schedule today. So if we were going back here to our widget and we're booking an appointment here, right, there are a number of pieces here, right? The assister, the date and time, and the location. since I think all of you on today's call are assisters, we're going to skip how to set up assisters and focus more on locations, schedules, and reports today, in the effort of giving more of a deep dive into that. So, locations. How do we add a location in the connector, right? I am going to set up at a community partnership, community college in the area. How do I go ahead and do that? So you'll go from this locations organizations tab to the locations page. It looks like we've got a number of locations in here already. And you'll add another location. Let's call this YI College. Young Men's Training Org. We're going to give this an address here. Washington, D.C. 20036, and a phone number, right? All the same information. One thing to note here is this organization field. Everyone uses the same connector, right? It's always going to be connector.getcoveredinamerica.org. So the organization here, if we clear this out, has to be linked so that we know who can access this location, who is responsible for it. So when you're filling in this or any other page that has a field like this, you're going to want to make sure to click on one of these highlighted pop-ups so that it knows to link to that record, right? So that this location we're added is now forever associated until we change it with Young Invincibles Training Org. The next thing we can do here is we can have a couple of different settings. We can mark a location as private, meaning it won't show up in the public-facing widget. We don't really recommend this. There are some cases where it's useful for if you're working with like a health center and you're getting just a navigator in there to do enrollment once or twice a week, but you don't want it open to the general public. That's a scenario we're working on with a partner in Central Florida. In that case, you might want to mark it as private. If it's, you know, but otherwise, you know, we find about 1 out of every 3 appointments are coming through that public or front end or widget side of the connector. 1 out of every 3. So you're really hiding yourself from being able to effectively find and enroll and reach consumers if you're marking things as private. Next, if there is a agent or broker location, we want to mark that just so that there's a disclaimer saying, hey, they may or may not be fair. They may or may not show you everything. We know a lot of brokers are great. We work with a number of agents and brokers, but we have to be honest about you know, what we're showing. Next, if they've been trained to work with LGBT persons or the LGBT population through our partner organization at Out to Enroll. If we go back to our results page here, I think there is a good one here. Yeah, we see this little rainbow icon here next to NOAA Midtown Health Center. That is because they've been trained by Out to Enroll on some LGBT competency issues, things involving culture, attitude, etc. Some things to know just about the population generally, as well as some health-specific questions. It's good cultural competency training. It's super easy. I recommend everyone go through it, and I'm happy to connect anyone who's interested with Out to Enroll. Lastly, you can choose any languages that are supported at all times by this location, right? So all times meaning all the assisters at this location will always be available to offer assistance in these languages. So if all of your staff is English, Spanish, you'd mark English and Spanish. If one member of your staff also happens to know Arabic or offers assistance in Creole or whatever, you can mark that a little later when we create schedules. But for now, we just want to keep it with the ones that are supported at all times by this location. So then we will create this location here, and we can see that it's been added to our location list. Right, so now we have a location, and we can go in and we can edit it, and we could change anything we wanted. Right, we could change this address here. right? And we can update that. And now that's there. If a location is no longer being used, right, we can get rid of it. We can delete it and make it inactive. So we can click this delete button here and get rid of it. If we need to bring it back, we can click this show inactive records filter. And we can see a couple locations that have already been deleted or made inactive. And we can bring them back by editing, checking this is active box, and updating locations. Right, so this way you can keep a constantly up-to-date list of what locations are still being active and running without having to manually hard delete and get rid of everything. You can just sort of take it out of the rotation. And these work on every page on the connector, which is really nice. So now we need to set up a schedule, and this is what we'll spend the bulk of our remaining time is on scheduling and calendars. So to add a schedule, you'll go here from scheduling to the schedules page. It looks like we've got a couple of schedules in here already. Let us add a new one. You can give it a title if you want. We'll call this just title. You can give it a location. We had our new YI College location. And you need to have an assister. So we'll have Jeff be our assister today. So Jeff is going to be at YI College offering enrollment assistance. Now, Jeff is concerned that he doesn't want people showing up randomly, willy-nilly, right before an appointment. So he's not prepared. He doesn't know what's going on or isn't ready for them, or he's running over with a consumer because he thinks he has time. So we have this option here, time before an appointment, after which it will no longer be publicly displayed for consumer booking. So if I'm scheduling an appointment here, right, this 3:30 appointment by default wouldn't show up basically anytime tomorrow after 2 p.m. Mountain Time, right? Jeff wants a 90-minute buffer between how far out or how close to an appointment someone can publicly book an appointment through the widget and when the appointment occurs. You can set that to 7 days, do hours, you can do minutes. 90 minutes seems generally recommended, but again, it's up to you what you want. If it's part of a larger enrollment event, you can track that. If just the schedule is private, maybe you're holding off, walk-in appointments, or you have a staff member who doesn't primarily do assistance, but could be brought in for busier times. You can mark just this schedule as private and give them that option there. And then, as we said, if Jeff also happens to speak Arabic on top of the English and Spanish, we can mark that as well and offer any accommodations, vision, hearing, wheelchair accessibility. Right, schedules are always going to be associated with just one location and just one assister. So that's how schedules work. We've set up our sort of framework of our schedule. Now we need to add sessions or the specific recurrences or rules or guidelines on when we have availability, right? When am I going to be doing this? When is Jeff here offering enrollment assistance? So let's do Marketplace Mondays. We can do Monday, starting next week, we'll say, and going through the end of open enrollment. He wants to be there from, Jeff's an early riser, so he wants to be there at 8 a.m., and he wants to stay late. He wants to go till 6 p.m. on Mondays. He wants to do 60-minute appointments, and he doesn't want to break between sessions. So we can create that here, and now we can see that saved. You can add as many sessions as you want to any individual session or any individual schedule, right? So we could do Tuesdays, Wednesdays, Thursdays, and Fridays. Marketplace, starting today, ending the end of open enrollment. Let's do 9 o'clock a.m. to 4 o'clock p.m. these days. Jeff has conflict in the evening, or maybe he's at a different location in the evening. So he wants to have just 9 to 4 the rest of the week. We can create these sessions here, and now those have been created as well. If I decide I no longer want to have this Monday session, I can delete it. It'll give us a warning, and because this is empty and there would be no issues with it, we could just go in and edit it, right? So maybe Jeff actually doesn't want to stay till 6. He just wants to stay till 5, right? So we can update that here, edit that, and make that a little more in line. We can then view the calendar here for the schedule we just created, right? And see all the different occurrences. You'll see the assister info, the location info, the languages, and the accommodations being offered. Any individual date will have all these individual slots, and you can view in a couple of different formats, right? You can view it by week, you can view it by day. There's a basic day if you don't like the calendar grid, and a basic week as well. You can scroll through this, and you can change your month as you see fit, right? So lots of options here. You can also view schedules or calendars, I should say, by location and by assister. So I'm going to check here. It looks like we've got 2 at Aaron's location and 2 for assister Roman Roy. So let's look at that. So Aaron's location here, right? Organizations, locations page. We have Aaron's location, and we can click on this calendar button, and it's going to generate. That's going to take a second because it's got to get all the occurrences for both the sisters and pop them into the calendar in the appropriate spot. Right, so we see a lot in here, right? A lot of availability, some grayed out stuff, some different looking icons, right? If we're looking at this week, we see an appointment, it looks like. We see different colors. What does all this mean? That's a great question. So the first thing to note is that you can select and unselect which of these assisters in this case you want to see, right? So if you're a site manager and you want to see when is each assister in this office, you can toggle on and off and see when conflicts could be, see when they're going to be there, etc., right? And get a good sense and confirm that that's all right. You can also do some stuff to change these appointments, right? So this appointment's grayed out. It's been inactive. We can make it reactive. And it will take a second to save our work and pop back up as an open slot. And essentially what we have, right, is you can sort of temporarily make an appointment slot unavailable or unable to be booked. If for some reason you want to block that time out. You could also say, hey, I don't want to do a 8 o'clock appointment tonight. I need to go home early for family reasons. I just want to get rid of this slot. You'll notice here that each time you select one of these, it's highlighted with a little red box around it, and you can delete it by clicking on the delete button, right? And that will just get rid of on the 5th or 8 o'clock appointment session, right? So giving you all the ability to not only just deactivate or sort of block off individual appointment slots, but physically delete them so that they can never come, so that they can't come back or they can't be reactivated. Now, maybe also I have someone who is looking for this last appointment today, but can't come in till 7:15. And I want to make sure that's reflected in my calendar. I can change the start time to 7:15 and the end time to 8:15, right? And I can make those changes as well from this page. And I can update it. So now this is going to show up as a 7:15 appointment, right? Again, more flexibility, more control, more ability to make your connector schedule look like real life, right? So now that's been updated to 7:15. I could also say, hey, on Friday, I want to come in just this one Friday. I want to come in an hour early and do a 2 o'clock appointment. I can click on the blue number for the date. Actually, we're going to use this on a different page. Let's go back to our schedules here. And let's look at this one. Right, so if I wanted to come in a day early, or an hour early, I can click on this date. It's got our schedule already picked out for us. We can give it a title, Weekdays of Open Enrollment. We'll do 2 o'clock p.m. to 3 o'clock p.m. And we can add this session, and we can add as many as we want, but in this case, we just want to add the one. So we'll say that's done. And now, when this reloads, now we have a 2 o'clock appointment, right? You also note here on the individual schedule page, you can see appointments that have been booked that are going to be highlighted in green, like this one. And they will show you the information about the consumer, as well as the ability to edit the appointment. And we'll change the icon from a clock to a calendar. So you have sort of a visual cue here of how, if an appointment's booked or not. Now, the other cool feature that we talked about that we added here, and to do this, I'm going to go to the Assisters page and look at one of these calendars, is the ability to sync this with your personal calendar, right? This is one of the things we talked about as a new feature for open enrollment, and we really want people to get familiar with it because I think it's really cool, right? So looking at this schedule here, I see I have appointments at different times at different locations. It's also confusing. I just want to know when I have appointments, and I want to be able to see at a quick glance here, when am I booked for appointments? So I click this iCal feed link button here, and it gives us a link. You could either manually copy it, or you can click the copy button, and it gives you this little feed URL, right, that we can sync with our calendar. So I'm going to show this on my calendar here. We use Google Calendars here at Young Invincibles. Instructions are on the homepage for how to do it for other systems. But on Google, right, from this very top here, you scroll down, you click the plus sign next to other calendars, and then you click from URL. You paste in the URL that we just copied, and we can see it's got the connector.capecoveredamerica.org, and we can add this calendar feed into here. Right, go back, and now we can see, right, appointments have been added, right? So I have my 7 a.m., my 10 a.m., my 3 p.m., right? So now my appointments are synced, and that will continue to update over time. So rather than having to add to your own personal calendar yourself, you have the ability to sync it with your personal calendar. So, right, so that's how that works. Again, iCal feed link, you copy it, and then you can import it. The other thing you can do from either the schedule by assister or schedule by location page here is that you can manage these schedules, right? You can say, hey, Aaron's schedule or the schedule at Aaron's location looks off. I want to go back and change it, right? And so I can see here all the schedules at this location that are available to me, right? So I want to edit Roman Roy's schedule. I go in and edit it. Actually, I want to manage, and I want to manage the sessions actually, right? And I want to extend Saturdays by an hour, right? So then I can go back, I can edit that and update it that way. The idea here again, going back to our schedule or our calendar page, right, is that not only can these pages be a view at a glance for you of sort of what's happening, but that you can go in and edit and manage things as you need to on an ongoing basis. You also notice that we've highlighted the current day in yellow to give you an extra visual clue of where we are in the calendar. So that covers the schedules piece here. I'm going to pause because I know that is a lot, and I want to see if we have any questions. Again, you can either type in the chat box or you can unmute yourself and ask your question that way. Cool. So cool. We've now looked at schedules. I want to take a look at appointments, right? How do we book an appointment in the connector? There are a couple ways to do that, right? From any calendar page like this, you can click an open spot and you can add an appointment, right? And the beauty of doing it this way is that the appointment is already filled in for you, right? So that can be super nice, in which case you'll fill out the consumer's information here. You can put in their address if you're keeping track of that stuff. We here at Young Invincibles really appreciate zip code information and county information, which you see is automatically populated. That's a core thing for us and allows us to track what's going on. And then there's a lot of other stuff we're going to look at here in a second, but this is how you book an appointment from the schedule page. We create an appointment, we save it, and it'll bring us back to the previous page we were on, which in this case was the calendar, right? And now this is going to load, right? And now our appointment for yesterday has been booked. You can also book an appointment from scheduling tab to the appointments page. One feature that's nice about the connector, before we look at that, is that you have the ability to narrow these things down any way you want, right? Anytime you see a bar that looks like this with a little search box, means that you can filter down what you see on the connector based on these results. So, for example, if I wanted to see everyone named Phelan, right? I'm trying to find an appointment. I can update my filters, and I can see just the 2 appointments named Phelan. I can reset that here and go back. It's also useful. I know this happens a lot during open enrollment. Someone calls you, right, and says, hey, I need to reschedule my appointment. Call me back. Don't leave a name. Don't leave information on when or where they were going to see you. But at least you have a phone number, right? You have a phone number so you can see who it is, and you can update the filters here and narrow it down. Okay, cool. It looks like Jeff here needs to reschedule his appointment, right? So that's really useful as well. But you can also add an appointment just from this page, which can be useful if you're not sure when you or where you want to book people, right? So if you have an idea like, come to this library, or I want to sit down with you, or if you're out in the field especially, it can be oftentimes really useful to use that calendar page. But oftentimes, maybe someone's calling your front desk. Maybe you got an email. Maybe it was at a big community event that you got people from, and you're now calling them back to book appointments. So let's fill out this here. Right, you can now find an appointment slot, and this works similar to the widget that we saw on the front end, right? We can search by zip code. and see all our upcoming appointments, right? But this is kind of confusing, right? How do I know which location or which assister or whatever, or I want to pick a specific date? We can narrow this down here. So I want to start with the 15th, right? And I can search, and now all the appointments available only show starting at the 15th. I really liked when I met Roman, so I want to make sure that I see him again when I book my next appointment. We've now narrowed it down to appointments after the 15th that Roman has available, right? And it looks like most of these are going to be at Aaron's location here, right? And we could pick an appointment this way, right? So we'll say this appointment works. So you can book an appointment this way as well. So I'm going to save here. So, right, we've booked an appointment. Peyton's come in. He was awesome. We got him a ton of help. You know, everything is going great. Now it's time to update our records, right? To close out this appointment and enter the data that we need. To do that, there's a couple things we do. The first is that what we require here at YI is really this section here, the zip code, the appointment status, and the enrollment status. We appreciate the more data you put in. It helps us tell our funders and other national partners what happened. But our top level things are, where are we serving people and what are sort of the general outcomes? So the two core statuses here are appointment status and enrollment status. Appointment status, as you can see, tracks sort of regardless of whether they enrolled, whether it was marketplace, blah, 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 blah. What happened to the appointment? Did they need to reschedule it? Did they confirm that they have an appointment? Did they complete the appointment? Did they cancel it? So we'll say Peyton completed his appointment. And then enrollment status tracks the general outcome, right? Enrolled, renewed, marketplace, Medicaid, generic for enrolled or renewed. It was a split application between marketplace and Medicaid for the family, some common reasons they weren't covered, or post-enrollment assistance. So let's say Peyton here got marketplace help. We can also track things like referral sources, right? TV, ABC5, telethon on 11/1, right? So we can track referral information. How are we finding people? Requested language, if they want to opt out of notifications or data sharing, we can suppress notifications. We can say they don't consent to data sharing. If you want to track like consumer experiences or stories, you can include those. If you want to track follow-up needs, reasons that a consumer needs a follow-up appointment, you can track that as well. But Peyton got enrolled here. He has a family of 3. They all had, right, and then this is our CMS section, right? So for navigators, these are your reporting requirements. For everyone else, you know, these are, you know, the outstanding, you know, these are often questions you may be wanting to do, but you should talk to your local manager about what is right for you. So we'll say 3, they all got enrolled in a qualifying health plan, and they all got tax credits. All right, and then we can update the appointment. Happily ever after, it's been completed. It's been booked. I want to pause again and see if we have any questions before we talk about reports, and then we talk about connector support. Cool. So quickly, I want to talk through reports, and then I want to talk through contact and connector support. So appointment detail report is the most common report. This is going to show you all of your basic sort of appointment outcomes. This is what you'll use for reports, for analysis, for looking backwards. You can update any of these filters going backwards. You can narrow it down by a sister, right? And then you can download this data into a spreadsheet that will pop up here in just a second, right? So now we have that same information, but it's now in an Excel file, so we can run whatever data analysis or scripts or templates we have to complete our grant writing, which is super neat. We also have a couple other reports here. We have an upcoming appointment report that shows us each upcoming appointment in the next 48 hours, as well as a link to go through and update it, which can be useful for confirmation calls, right? So I go through here, I say, hi, Jeff, I want to confirm your appointment for tomorrow at Jeff's location. Jeff says, great. We mark him as confirmed as our appointment status, and we can update this appointment here and let that be done. We also have a list of unclosed appointments, right? So the last 7 days, these are appointments that have been booked, but aren't in our minds closed out. So what do we mean by that? So a closed out appointment has an appointment status of either no-show, completed, or canceled. And it has an enrollment status attached to it if the appointment was completed, right? So if this appointment is completed, it has an enrollment status in Marketplace, this is closed out. If it's canceled, this is closed out. If this needs to be rescheduled, then that still isn't closed out, right? So this helps us understand all the data that's in the connector, and again, tell everyone what's going on, and really share to the world the success of open enrollment. So those are reports. Some of these are new. Feel free to offer us feedback as we go, and we'd be happy to talk more about it. The last thing I want to talk about here before we stop for questions, finally, and let you all go at the top of the hour, is contacting connector support. We here at Young Invincibles love to hear from you guys. We love to provide support. We're always happy to work with you all. But there's some best practices for getting help on the connector. Now, first is you should ask your manager or local connector admin. Whoever gave you your access to the connector is oftentimes a great resource, and we really recommend that you lean on them, especially for basic questions. They have a wealth of expertise that can help get to you quicker. They may know weird quirks or things or standards that you all have that we here at YI aren't aware of, and so they're really useful. But failing that, or if they're stumped, or if you're like, oh my God, I think I broke the entire connector, or something seems horribly wrong, connector support at younginvincibles.org is the place to go. Some tips for us, and I'm sure your managers will appreciate this as well. Please be specific as possible. Emails that say, my schedule at Jeff's location isn't showing up on the widget past next week is a lot more useful than the widget in my schedule are broken. So information in both the subject line of your email as well as in the body of your email, super important, super helpful. Second is include URLs and screenshots. As we showed before, each item in the connector has its own unique ID and its own unique link. That makes it easier for us to track down what's going on. Absent that, screenshots, I guess, are okay, but URLs are better so that we can see what you're seeing. And then lastly is just be patient. We do have a couple people helping out. Myself and our great colleague, Nina Schultz, are working tirelessly to make sure that your support issues get answered. But there's only two of us. And you know, sometimes these things get tricky. Sometimes we don't have an immediate answer. We do have a 24-hour turnaround policy here at Young Invincibles. So if it's been a day and you haven't heard from us, please feel free to bug us again. Please feel free to be like, hey, have you figured this out yet? But it doesn't help if we get 5 emails from you about the same thing on the same day. We work through these. We're trying to get through everything as quickly as possible. Oftentimes, it's a lot quicker than 24 hours, but again, please just be patient and know that we're working. So we've got 2 minutes left here. I want to stop and see if anyone has any questions today. I know we've covered a lot, but I want to make sure that everyone has a chance before we wrap up to ask any final questions. Great. Connector support at younginvincibles.org, obviously for support issues. If you have ideas about future improvements to the connector, modifications, design things, regular, things that irk you, or feature requests, or ideas of what you want to expand the connector to do in the future. Or alternatively, if you or your organization is part of something outside of open enrollment or working on, something where, research, technology, web, mobile development, focus groups, etc., anything involving connecting with young adults, any services we can provide sort of beyond just ACA support. I'd love to talk to you about why I can support you in that work as well. So my personal email is phelan.o'neill@younginvincibles.org, and I would love to hear from you all. With that, I will give you back the remaining seconds here before the 3 o'clock hour hits. I hope you have a great rest of your day. I hope you have a great rest of your open enrollment. If you enjoyed today's training, if you thought it was helpful in any way, please tell your friends, neighbors, colleagues, associates, other assisters, tell the world. Tuesdays and Thursdays at 2 o'clock p.m. Eastern at this very place. We're doing these trainings throughout open enrollment, and I hope to see, if not you all, then your colleagues soon. Have a great rest of your day.